Hello and welcome to the Feeling Good podcast. I am your host, Fabrice, and joining me here in the Murrieta studios is Dr. David Burns. Hi, David.
Hi, Fabrice.
Dr. David Burns has been a pioneer in the development of cognitive therapy, and he is the creator of the new team therapy. He is the author of Feeling Good, which has sold over 5 million copies in the United States and has been translated into over 20 languages. He is an emeritus adjunct clinical professor of psychiatry at the Stanford University School of Medicine. All right, so we're going to start today a series on anxiety, and today's podcast will be kind of an introduction about, well, what is anxiety? We need to kind of define what we're talking about, and how it's treated. Anxiety versus fear. What's really the difference, and how does anxiety differ from depression? So we have a lot to cover here, and so we'll have several podcasts on this. So why don't we get started?
And I might say that today will be kind of an introduction to anxiety. So some of the understanding anxiety, the kinds of anxieties, but the podcast will be focusing on powerful, specific techniques that people can use to overcoming anxiety.
Yes.
It's going to have a real practical, helpful focus, I think.
So why don't we start with what anxiety is? I mean, what are we talking about?
Well, synonyms for anxiety would be, worry, nervousness, fear, frightened, panicky. You can contrast anxiety with depression, and my mentor at Penn, Aaron Beck, had I thought a really good way of contrasting them. He said, when you're anxious, it's like you're hanging from a cliff by your fingertips, and you're worried about falling at any moment. The whole idea in anxiety is something terrible is about to happen. It hasn't happened yet, but it's going to happen at any moment. And depression, by contrast, it's like you've already fallen, and you're at the bottom of the cliff, and your arms and legs are broken beyond repair, and you feel hopeless. The tragedy has already happened. That I thought that's a useful contrast.
It's kind of a past versus future. Like, if you want to be anxious, get yourself a future, and if you want to be depressed, get yourself a past.
Yeah, right. And but depression and anxiety often go hand in hand. If I measure depression and anxiety on scales that are continuous, like 0 to 10 or 0 to 100, any way you want to look at it. And if you take people who have significantly elevated depression scores, so they're feeling down and blue and unhappy, nearly 100% of them will have elevated anxiety scores. Anxiety virtually always accompanies depression.
Well, we know that people who are depressed have actually very high stress hormones. They have high cortisol.
Yeah. Sure. Those are, probably non-specific symptoms of emotional states. They're not very accurate, as it turns out, but because you can have, severe depression and anxiety without having these physiological, hormone levels and things that people like to talk about. But on the other hand, if you're anxious, there's only a 50% chance that you'll be depressed. You can have anxiety without depression,
right?
But you can't. It's very unlikely to have depression without anxiety. And an example of that is, let's say you have a phobia of some kind, the fear of heights or the fear of flying, but you might not be feeling like you've got low self-esteem or you're worthless because of that. I happen to have this fear. So you can have anxiety without depression.
Right. Doesn't necessarily lead to despair. So we have an idea now of what anxiety is and how it differs from depression. How does it differ from fear?
Yeah, that's a good question. And then we can talk about the kinds of anxiety as well. But the difference between healthy fear and neurotic anxiety, they both result from negative thoughts. And this is the cognitive model that we talked about in an earlier podcast. You have to have a perception, interpret what's going on in a particular way before you can have any emotional reaction. And so, for example, the thoughts that cause depression are generally, I'm worthless, I'm no good, I'm hopeless, my problems will never be solved. The thoughts that cause anxiety are always the prediction of danger. Like if you're about to give a talk, you might be telling yourself, I'm going to blow it. My mind will go blank. People will see that I'm nervous. I'll make a fool of myself. People will judge me. Things of that nature. Now, fear is also caused by negative thoughts predicting that something bad is about to happen or might happen. But the difference is that the thoughts that cause anxiety are always wrong thoughts, distorted thoughts. When you're anxious, you're fooling yourself. You're telling yourself something that's not true. And we can come to the distortions that cause anxiety in just a moment. Mm-hmm. But when you're afraid, the negative thoughts that are making you afraid are valid thoughts. And healthy fear is a good thing. It's not something you need to treat with, a medication or psychotherapy. For example, the world is becoming increasingly dangerous, and if we as Americans were to visit the Mideast, say Iraq or Syria or something like that, we would be frightened walking around on the streets at night. Yeah. And we would have thoughts, I could be killed. People here hate Americans, and my life is in danger. I've got to be careful. Or it could be walking around in Chicago at night too, in a gang warfare kind of area. Yeah. And those thoughts are true, valid thoughts, and the anxiety will help to keep you alive, keep you alert.
So you wouldn't try to cure that?
No. But when you're anxious, you're involved in a lot of mental cons, and maybe we can, talk about those a little bit as well as, what are the different kinds of anxiety. Why don't we just talk about the different kinds of anxiety first?
Sure. How about we talk about the different kinds of anxiety?
I'm glad you asked me that question, because I think, most human beings, I would say probably 2/3 struggle from time to time with some form of anxiety. When I do workshops for mental health professionals, I say, how many of you have personally experienced some kind of anxiety, public speaking anxiety, performance anxiety, or whatever? And almost all of the hands go up. But one category of anxiety is just, in DSM-5, they call it generalized anxiety disorder. DSM-5, the American Psychiatric Association, uses big words to say simple things. I just like to call that chronic worrying. Mm-hmm. And some people just tend to worry, and they're worrying almost every day about, the family, the health, various kinds of things. And that can be very severe and incapacitating sometimes. Another common form of anxiety is performance anxiety and public speaking anxiety. For example, I used to have, I've had so many forms of anxiety. One reason I love, talking about anxiety and treating anxiety, when I wrote my book, and I don't know if I mentioned this in a previous podcast, but when panic attacks, which is on all of the different anxiety disorders, yeah. I counted up all the forms of anxiety that I've struggled with, phobias and fears, and, there's more than a dozen of them. So I just love anxiety, because whatever my patients have, I can say I've had that too, and I know how awful it is, and I can show you how to overcome it. But, I've had severe performance anxiety and public speaking anxiety, and in the past it could be for an athletic performance or a musical performance. Most people get pretty nervous and uptight, or test anxiety would be another version of that. And then there's just general social anxiety or shyness. And boy, I can't tell you how many people I've treated over the years and continue to see to this very day who have severe social anxiety and always worrying about being in groups of people and fear that, people are going to judge me. They're going to see how anxious I am, and I don't have anything interesting to say, and I'm the only one who's feeling insecure. And then we've all heard of OCD, Obsessive-Compulsive Disorder.
Yeah.
That can be severe, although with the new team therapy techniques that we've developed, they actually, in most cases, can respond very, very quickly now to treatment. But OCD, and there have been movies about it, like the one about Howard Hughes. He was walled up in Las Vegas and afraid of contamination and afraid of touching people. OCD has obsessions, which is recurrent, frightening thoughts that come into your mind, like, oh, maybe the house is going to burn down. And then a compulsion is a behavior that you do over and over again to try to undo the anxiety. Like you might go and check the stove before you go to bed, make sure it's turned off, and then you keep checking over and over again. Or some people count things or have different rituals that they have to get involved in. OCD is really, really interesting, and it seems a bit bizarre too.
Now, isn't there a common component to the four you listed? In fact, you talked about chronic worry to begin with, and it seems like there's worry in all those cases. You worry about how you're going to perform. You worry about what people are going to think about you. You worry about whether the house is going to burn down. So,
or getting your hands contaminated, and then you have to wash your hands 50, 75 times a day.
So there seems to be like a common thing to this.
Absolutely, yeah. Like something terrible could happen, and life is not safe. I'm not safe.
Yeah. So, for example, what's the differential factor between, let's say, performance anxiety and social anxiety? Aren't you afraid of what people are going to think about you in both cases?
Yeah, absolutely. Absolutely. In fact, they're categorized together in the DSM. Mm-hmm. Social anxiety, there's 5 types of social anxiety listed in DSM. See if I can remember them all. Maybe we can come up with them. One is performance anxiety. One is public speaking anxiety. One is shy bladder syndrome. That's remarkably common, actually. That you're afraid to go to the bathroom in public because you're going to tighten up, and then you won't be able to pee, and then people will see that and think there's something wrong with you. And then pure shyness. Are there any other forms of social anxiety? I'm trying to think. Test anxiety, public speaking anxiety, performance anxiety, shyness, and then shy bladder syndrome.
Yeah, I'm looking it up right now.
I think that's the main ones. While you do that, I'll just mention a couple other common kinds that we hear about in the news all the time. Post-traumatic stress disorder, which is kind of a partly realistic, partly a fantasy, to tell you the truth, because most people who've had trauma do not actually have the symptoms of post-traumatic stress disorder. Yeah. But it's feeling, very, very anxious after you've witnessed some horrific traumatic event in war, or you've had an experience of being raped or some such thing. Then there's body dysmorphic disorder, which is compulsive disorder in a slightly different category, but it's simplest just to think of them as anxiety disorders. But body dysmorphic disorder is the idea that some people develop, and we could go over a case of this in a later podcast, that you develop the belief that there's something abnormal about your appearance. Like you may think your legs are too fat, or your face is crooked, or you have a scar on your nose, or some such thing like that. And then you keep checking over and over, asking people, can you see that I look peculiar, or checking in the mirror over and over again. That can be very, very severe. I used to go up to Harvard once a year to teach when I was at Penn in Philadelphia. And I would sometimes do live demonstrations of what was then cognitive therapy, which seemed new and different at the time. They were mainly psychodynamic at Harvard and psychopharmacology, and so they would arrange these live, patients for me to treat. One year they said they were going to have me treat the most severely depressed man in Boston. And while 80 psychiatrists watched. And then they wheeled the patient in from the intensive care unit where he had just made a nearly completed suicide attempt. And so they wheeled body dysmorphic disorder. And his problem was that he thought his hair transplants, and he thought they looked like a corn patch on his head. They did a little bit. It was a bit artificial looking, but he was just absolutely convinced this made him unacceptable to women, and he was very, very obsessed about that. That can be quite incapacitating. Although the prognosis with the new team therapy techniques for all of these is extremely good. And then another two that are common that sometimes go together are agoraphobia and panic attacks. Panic attacks is where you have this sudden experience that comes out of the blue, like you're going to go crazy or you're going to die, and it's very catastrophic and dramatic form of anxiety, and or that you're about to go crazy. Generally, as you know, Fabrice, disappear after 20 minutes or thinking that there's something drastically wrong with them, and then sometimes these people get housebound, called agoraphobia. They're afraid to go outside for fear that they'll be in the grocery store and then have a panic attack and go crazy, and there won't be anyone there to help them. I think that's the main types of anxiety.
Yeah, just looking at the official DSM list here, they list as anxiety disorders separation anxiety disorder, selective mutism, specific phobias, social anxiety disorder, panic disorder, agoraphobia, and generalized anxiety disorder.
Yeah, well, that's a good list too. I don't think we're going to go into selective mutism. I haven't had any of those cases, but the common ones will certainly be going over. Now, we were talking about the difference between healthy fear and anxiety, and there's one is in all of these, it's caused by thoughts that something terrible is going to happen.
Right.
But the thoughts in anxiety disorders, the thoughts are not true thoughts. And we've talked about cognitive distortions in previous...
Yeah, we done several podcasts on this, yeah.
Yeah, but we could just highlight a few of them that are common in anxiety. But, all or nothing thinking is really the key to...
It's like a blanket, distortion and a lot of problems like this.
Oh, yeah, it's like, if I'm not a total... success, I'm a complete failure. You're looking at things in black and white categories. So when you have public speaking anxiety and performance anxiety, there's a lot of that all or nothing, black and white thinking going on. Jumping to conclusions is huge in anxiety. These are big in depression, but some of them are also big in anxiety, like mind reading and fortune telling. Mind reading is assuming that people are looking down on you. Yeah. Without any good evidence, and that's the key to social anxiety. You just think, oh, these people. In fact, we had someone on the Sunday hike, a mental health professional who had tremendous social anxiety, a lovely woman, but had some concerns that people might judge her because her training wasn't the same as some other therapists, and felt quite real to her, and very, a tremendous young therapist, and we were able to work that through. I've experienced that myself. I remember once being asked to go up to Harvard to give a talk, and they said there was going to be a reception the night before, and so I'm supposed to come to this reception, and there must have been about 50 people there, and they were all kind of Harvard big shots, and I mean, I don't mean to be disrespectful, but they were like all dressed very fancily, and they were quite well known, many of them. And I remember just feeling so anxious and just wishing I didn't have to be there, thinking I'm out of my league and these people are in some other, super category, and I'm just kind of very, very unimportant by comparison. And in fact, I've experienced that. I can give a lot of examples in the past where I had that. But that's the mind reading. These people, they're fantastic. They don't have flaws. They never worry. They wouldn't be interested in me. And then the fortune telling, of course, is the key to all of anxiety. That I'm in terrible danger right now. If I get on the plane, it's going to crash. If I give my talk, I'm gonna blow it. If I don't wash my hands, they'll get contaminated, and some catastrophe will occur. Magnification is huge in anxiety. Magnification and minimization. You take a real danger and you blow it out of proportion. You magnify it by a factor of 1,000 or 10,000, like if you have the fear of flying, most people with the fear of flying, it can be due to a lot of different kinds of thoughts that cause it, but the most common one is the plane is going to crash. And although there's a little tiny chance that a commercial plane would crash, the odds are like, that you would die in a commercial airplane crash are like 1 in 10 billion or something like that. But the person who's anxious, they magnify that and they think that's like a 1 in 5 or something like that. The emotional reasoning is huge in anxiety and in depression also. But in anxiety, you're saying, I feel frightened, therefore something bad is going to happen. You reason from the way you feel.
I've often wondered about this one because, as you said, the emotions of fear or anxiety, it's caused by a thought. So why would we feel fear if there hasn't been a thought prior to that?
Well, there could be a thought prior to it, but then you reason from it. It becomes like a vicious cycle.
Uh-huh.
You say like, well, what would be a good thought that causes anxiety? Well, if I get on that plane, it's probably going to crash, and then you feel afraid.
Yeah.
And then you get to thinking, gosh, I'm so scared right now. This must be a dangerous situation that I'm in. It's that kind of vicious cycle. And another huge one in anxiety, and this is perhaps a key point too, is the should statements and the shame. Most anxiety sufferers feel a lot of shame about the anxiety. When you're depressed, you often feel low self-esteem, like I'm not worthwhile. But in anxiety, it's more like there's something wrong with me. I can remember I treated a lovely young woman, an attractive young woman, and she was kind of a tour guide in a museum or something like that, and so she would be showing groups of people around. But she had intense anxiety, and her fingers would shake. And she'd have the thought, the people here in the tour, and particularly if it was an attractive young man, she'd been thinking, oh, they're going to see how nervous I am. There must be something wrong with me. I'm defective. And she would feel a tremendous amount of shame. And shame often complicates the feeling of anxiety. And it can also be caused by labeling, another distortion, like instead of saying, I failed at this, you say, I'm a failure, or the anxious patient, or I'm a jerk, or I'm a loser. And that's like an extreme form of overgeneralization, so it makes any disapproval or failure or very, very, very dangerous. And then the should is I'm defective, there's something wrong with me, as if there's a problem with your essence.
Wouldn't that be more conducive to depression and anxiety? Those types of distortions, the labeling and the should, like I should not do this, or I'm a failure, things like this.
Yeah, when it's I'm a failure, it's depression.
Right.
When it's if I screw up at my talk, I'll be a failure, and then people will look down on me and they'll see that I'm a loser, and then that's the anxious part. It's like the thing hasn't quite happened yet, but the labeling can be occurring in both. And go ahead.
When you do labeling, does that always apply to oneself, or can you be labeling something else?
Yeah, but you won't be anxious if you're labeling other people. Like sometimes when people get rejected, they say, I'm a loser, I'm unlovable, it's all my fault. And then someone will try to cheer them up and say, oh no, he's a loser, he's a jerk, type of thing. So you go from self-blame to other blame, from labeling yourself to labeling other people. And there are different kinds of traps, but they're both traps. And when you label other people, it's very popular to label other people politically and personally, and to blame others and to look down on them. But outward-directed blame causes anger and resentment. And inward labeling, when you label yourself, it creates depression and anxiety and shame and guilt and inadequacy.
Is it possible to label something also? Like when I'm thinking of, for example, let's say if I look outside right now, the weather is overcast, and I'm labeling it by saying, oh, it's bad, when in fact there's no good or bad about something being overcast. Wouldn't that be considered labeling also?
Yes, you can also have outwardly directed blame, like you're having a picnic and you say it's unfair that it should be raining today when I'm planning my picnic, and then you get all angry, and so you double your trouble. On the one hand, you have to cancel the picnic, on the other hand, you have to deal with all the inner angst that you generate. And
so that would be a form of labeling.
Yeah, and blame.
Okay.
Mm-hmm. Yeah, that outwardly directed, shoulds directed outwardly, blame directed outwardly, and labeling directed outwardly. They go together in a package that creates frustration and anger.
Okay.
So that's kind of a little bit of an overview of anxiety. And as I say, we're going to get into showing techniques that really work. But maybe our next podcast, I can give an overview of the 4 powerful treatment models for anxiety, and then we can begin to bring those treatment models to life.
Sounds great. Well, that was a great overview. I think that we get a good sense of what anxiety is, where it comes from, and how to distinguish it from healthy fear. So thanks for this podcast.
Okay, thank you, Fabrice.
See each other at the next one.
Time went fast.
As always. This has been another episode of the Feeling Good podcast. For more information, visit Dr. Burns' website at feelinggood.com, where you will find the show notes for this podcast under the blog page, and where you can leave your comments and questions. The website has an abundance of resources for therapists as well as non-therapists, including books, workshops, a list of online training groups around the world, and much more. Theme music is Gypsy Jazz in Paris, 1935, composed and performed by Brett Van Donzel. I am your host, Fabrice Nye, and I invite you to join us next time for another episode of the Feeling Good podcast.